Here we'll talk about VKH syndrome. The V stands for vitiligo and uveitis, and in the word harada, the letter R stands for retinal detachment and the neurological manifestations. So, what is VKH syndrome? It is an idiopathic or autoimmune multi-system inflammation of melanocytes. So, the melanocytes word you need to remember in this syndrome, the melanocytes get inflamed in multi-system, causes many different multi-system manifestations like cutaneous manifestations like alopecia, vitiligo are like the white spots on the body, poliosis, neurological manifestations like meningitis, encephalopathy, auditory manifestations like tinnitus, vertigo, deafness, ocular like uveitis and anterior and posterior uveitis. So, what is the etiology? What is the cause? It is HLA-D4, DR4 or HLA-DR1 mutations, and it is most commonly seen in Japanese and the melanized people. And also, if there is any prior viral infections or injuries, this can also sensitize the melanocytes, which can easily get inflamed and cause this VKH syndrome. So, it has four stages. One is the prodromal, second is the acute, and third is the convalescent. Fourth is a chronic recurrent phase. So, just remember in the prodromal stage, the systems affected are CNS and the ear. So, what happens if the CNS get affected? It can either cause meningitis or encephalopathy. If the ear get affected, it can cause tinnitus, vertigo, and deafness. And in the acute stage, the eyes are involved. That means uveitis. And in the third stage, cutaneous system is involved, like alopecia, vitiligo, poliosis. In the fourth one, chronic recurrent, eyes are involved. That means smothering, anterior uveitis, and exacerbation. So complications of this VKH syndrome is cataract and glaucoma. Treatment, you can give steroids like prednisolone, methylprednisolone. Prednisolone is 6 to 100 mg per day. Methylprednisolone is 500 to 1000 mg per day. For the resistant and the recurrent infections, you can use methotrexate or cyclosporine. You can remember it with this mnemonic, I guess. The area where the hair is not present, it represents alopecia. And coming to the ear, this red color thing, you can see this tinnitus, the bell ringing sound in the ear, and the deafness where I put a cross mark, that means he cannot hear it, and also vertigo, he cannot balance properly. And near the eye, you can see the white color spot, which is anterior uveitis, and also the white represents vitiligo, right? So the eye undergoes vitiligo, and spots around the eye or spots on the skin, whitish patches on the skin represents vitiligo. So I think you can remember it with this mnemonic. So once again, if you see the syndromes, it is symptoms. It is alopecia, vitiligo, encephalopathy, tinnitus, vertigo, deafness, and uveitis. So brain, eyes, ear, skin are involved.